Today we have an esteemed physician who is at the Jesse Brown VA, Dr. Augusto Alonto, attending physician at JBVA, a leading voice on COVID-19 vaccine issues. And today we will be discussing COVID-19 vaccine safety, efficacy, and issues related to hesitancy in receiving the vaccine. So welcome, Dr. Alonto.
Thank you very much for having me on your show.
Oh, great. Maybe you can lead us off and give us an opening statement about what COVID-19 is and how vaccine safety and efficacy really are rolling out now. We've heard a lot in the media about that, but give us an update on what's going on.
Okay. So first of all, COVID-19, as we all know, is a virus that can cause severe infection like pneumonia among mostly the elderly population, but the younger people can also be affected, and it's the cause of this pandemic that's been going on for over a year now. Luckily, we now have a safe and effective vaccine that have been developed over several months and tested over several months, and it's been proven to be safe and effective. And it's now available to everyone who would want to get the vaccine, and I encourage everyone to get the vaccine.
Yeah, it's really highly effective. And, I had a point where I was doing some Zoom talks with people, and one of the reflection points I had was back in February, on February 28th, President Biden and Vice President Harris were at the reflection pool in Washington, D.C. with the luminaries lit up, in front of the Washington Monument. And they were, representing the lives of the people who had been lost. And the one thought I had was, what if we had a vaccine that was so effective, so safe, back in the year 2020, in January, or back in 2019 in December, and people had actually been vaccinated. We actually would have probably lost very few, if any, lives if people had been fully vaccinated.
It would have, definitely. I think it would have saved millions of lives. And, one of the ways to end this pandemic and to get back to our normal lives the way it was is to get vaccinated. I totally agree.
Yes. Yeah, so what is this thing about variants? What are those?
So the virus can be very tricky. It can change so that our immune system doesn't recognize it. And so the variants that we see mostly in other countries are pretty much that's what it sounds like. It's a variant of the original virus that can cause more infections and more severe infections. Luckily, the vaccines that we have available work against the variants, and we're studying to see how well it works. But we do know that the vaccines work against the variants.
Oh, yes. Yeah, because I've heard of this before. One of the ways I sort of described it before was if I were in a rowboat in Lake Michigan and a wave hit the right side of the boat and then left side of the boat, I would sort of drift from side to side. But if someone took my rowboat and threw it into an ocean, it would turn into an ocean liner, and that would become a major shift. And so what we're seeing right now is small changes, right? So that's why you were saying that this vaccine that we have now seems to be covering those strains, right?
Yes, definitely. And, we are the manufacturers of the vaccines are also testing newer vaccines to better protect us against the variants. We don't know what the results are of those tests yet are, but for now, the available vaccines that we have should be effective against most of the variants.
Fantastic. One thing, maybe you can explain this a little bit more for us. Like, what are some of the common side effects of being vaccinated, And then maybe you can talk about what happens if you don't get vaccinated and you get ill from this virus. What can happen to you with hospitalization and ventilator usage and that type of thing?
Yes. So I'll talk about first what can happen when you do get the infection from COVID-19. Mm-hmm. So we all know that COVID-19 can cause serious illnesses, including death. The most common ones we see in the hospital when people get hospitalized are pneumonia or lung infections that can lead to ventilators and prolonged illnesses, including I've also seen people who have had kidney failures requiring dialysis, and neurologic events, significant blood clots, things like that. Those are what we hear in the news. Other less common things that we hear in the news but can also be significant include loss of taste, loss of smell, and those could last for a long time. And so even when people aren't sick enough to go to the hospital, they can have long-lasting effects. So they don't enjoy their food as much, and things like that. And that's what I've seen. It can also cause blood clots that are life-threatening. Now, side effects from the vaccines. The most common ones that we see are redness and soreness of the arms. Sometimes we can get headaches and fatigue and muscle aches. But those only last typically about 2 to 3 days. And, when my patients get side effects from the vaccines, that's when we know that our immune system is revving up so that we can fight against the infection.
Okay, very good. Yeah, because I got my vaccinations myself, and I tell people, when I got my first one, I had a little bit of soreness in my left arm, and then when I got the second dose, I had a lot of pain in my right shoulder because what I was doing is running for a Zoom meeting and hit my shoulder on a wall, and I actually got the vaccination on the left side and had little or no side effects. And I've heard some people saying they had a slight fever or they felt, under the weather for a day. But that pales in comparison to what you were talking about with being hospitalized and put on a ventilator, huh? Yes,
and, definitely. I've experienced it firsthand. Both my parents got ill from the virus this past summer. And my mother was in the intensive care unit during the summer for a couple of weeks. And when she luckily recovered, when the vaccine was available, she took it, and her side effects were mild. And she said that she would definitely get the vaccine anytime over the actual infection.
Oh, my goodness. Well, Dr. Alonto, I'm going to give you a 1-second break to say Happy Mother's Day to your mother, and I'm glad she's still with us.
Happy Mother's Day to my mom and to my wife.
And to your wife. Oh, you got that. That's good. You want to have peace at home. So let's get to, what about the hesitancy? Some people are hesitant, even though we know the science of things. I always tell students, remember that science never asks for you to believe in it, but it is incredibly unforgiving if you don't. So if you walk to the edge of a cliff and decide to take an extra step, gravity doesn't care whether you believe or not, but you will be a believer at the bottom of the cliff by the time you get there. But
yes.
So what is the thing that you think is causing this hesitancy among people?
So when I talk to patients who have some hesitancy about getting the vaccine, one of the main things that I hear is that the vaccines were developed in such a short amount of time, and were there shortcuts done? What I tell them is that there were no shortcuts done. All of the vaccines that are available have been approved by the FDA and have gone through the whole rigorous process. The only difference is instead of doing it over several years, it was done over several months, because a lot of the steps were done at the same time rather than one after another. But it had gone through, these vaccines that we have now had gone through all the phases that the FDA requires to be approved. And so it is as safe as any other vaccines. So that's my answer to that. The other thing that I hear is that is there a lack of data, and there is excellent short-term and long-term data. You know, of the three vaccines that are available in the United States right now had been tested. They have been tested in more than 100,000 participants, and it's been shown that it's safe and effective. It's close to 100% for preventing severe illness, hospitalizations, and even death. So that's the second one. I also hear that the vaccine can give you COVID. There is no live COVID virus in the vaccine, therefore it cannot give you COVID. And so those are the three things. And the main thing that I'd like to stress is that the vaccines that we have available are safe and they are effective. And not only will they prevent illness from the person who received the vaccine, but it will also protect those who have not yet received the vaccine. So I mean, those are important things to remember and be vaccinated.
Yeah, because a couple of things I always like to highlight too when I think about this subject is, people sometimes will say there's a microchip in it, and I go like, if there was a microchip in it, you might as well throw away your credit card and your cell phone because they already know where you are. So no one wants to track you through a microchip in a vaccine that's not part of the formulation for it. And also, we hear sometimes about the Tuskegee study that was sanctioned by unfortunately, by the U.S. Public Health Service back in 1932 to 1972, about a 40-year span. But the thing is that there's a misconception or, misinformation, and we have to go to the right sources when we get information. But there's someone out there saying, had 17,000 followers, who said that these men were injected with syphilis and then they weren't given penicillin. They were never injected with anything. They were diagnosed as having syphilis and then not given penicillin. So for those people who feel that that is something that could be done to them, not getting the penicillin is a treatment. It's a way, an intervention that can prevent you from having the natural unfolding of the disease. So by not taking the vaccine, you're putting yourself in the same position as those men in that study.
Yes, and so, I agree. I mean, so there are no microchips in these vaccines. And also, since 1932, we have learned a lot. And, for these studies, there are strict guidance and guidelines so that, each participant would know what is being done to them. At the Jesse Brown VA, we participated in the Johnson & Johnson vaccine trial. And, every step of the way, we were letting the participants know what was going on. And if there were things that were unexpected, we would also let them know. So they knew everything that was going on, and, nothing was kept secret.
Yeah, and when it's the most scrutinized probably vaccine ever, right? And I was, actually in the military when I was going overseas, we get like 4 or 5 vaccines, simultaneously, and we all survived it. I actually am glad that I did get vaccinated. Who knows where I'd be right now if I did not have that protection going, to different countries. I went to about 23 different countries. And so I'm really grateful for the science and for the technology and the healthcare system that created these things. Much of it came from actually the research being done at VA systems, historically. So I'm just glad that we have this. But tell us, at the VA, who can get get vaccinated now, and what does someone do to get the appointment to get vaccinated?
Yes, so all veterans can get vaccinated now. All veterans 18 and over, their spouses, their widows, and their caregivers, 18 and older. They would just need, the spouses, the widows, and the caregivers would just need an ID, and they can call 312-569-5801 to make an appointment. That's 312-569-5801. We have a vaccine clinic at 2215 Harrison, and it's open Monday to Friday from 8 a.m. to 4 p.m. and also every third Saturday from 8 a.m. to 4 p.m. Walk-ins are also welcome between 9 a.m. and 2 p.m. on weekdays. And in addition, tomorrow we have a Mother's Day vaccination clinic from 9 a.m. to 3 p.m. at 4259 South Berkeley Avenue. That's Comed Homan Health Center in the near North Health. And if someone has any questions for that event for tomorrow, the number is 773-533-7520.
Oh, fantastic. Excellent. I'm going to get you to give that again in a moment, just that same information, so people have their pens and they're there. But any last words you want to give? We have about 2 minutes to go. But, something that you feel is critically important for people to know. Why is it so important to get this vaccination?
Yes, so again, this vaccine is probably the safest vaccine that's ever been developed. It's safe, it's effective, and one of the ways that we can end this pandemic is for everyone to get this vaccine, and this vaccine can lead us to our normal lives once again. Mm-hmm. So I just urge everyone to get the vaccine. It's available. It's available to everyone 16 and over. And soon it'll be available to the children as well.
Okay, and give us those numbers again, the phone numbers and the locations.
Yes, so the Jesse Brown VA Vaccine Clinic, the phone number to make an appointment is 312-569-5801, and that clinic is in 2215 Harrison. And tomorrow there's a Mother's Day vaccination event. Tomorrow is Sunday, May 9th, from 9 a.m. to 3 p.m., and it's in Comed Homan Health Center at 4259 South Berkeley Avenue. If there are any questions, the number to call for that one is 773-533-7520.